Hi, it's Dr. Centeno, and this is the second installment of my botched stem cell series. And I'd like to go over Terrell Owens' stem cell procedure. Hey, given that we invented many of these procedures and are leaders in this field, we really want to make sure that you understand the difference between a high quality and a low quality procedure. And the patient here is former pro athlete Terrell Owens, who had his procedure amazingly filmed by TMZ. And the question is, was this a high quality or a low quality procedure? And can we tell by this video? Well, exhibit one is that this was a low yield site. The front of the hip yields far fewer cells than the back of the hip. There was no guidance. You didn't really need to use a hammer, but one was used. So that's the first issue. The second issue is that we see a single large volume pull of 30 cc's of bone marrow from the same site. And regrettably, that's not best practice. In fact, best practice would be to draw no more than 5 cc's from each site. So this provider would have had to seat that trocar very, very deep under x-ray guidance, and then would have to draw a little bit at each site as he pulled out. What he did here was to ensure that Terrell Owens was getting a lot of blood and very few stem cells. Exhibit 3, the nurse lists far too many sites to treat in any one same-day bone marrow stem cell procedure. Both knees, bilateral triceps, bilateral shoulders, right hip, lower back, hamstring, groin, 10 different sites. Now, we already know that this is a poor bone marrow stem cell procedure because it's the wrong site to draw from, and it's the wrong way to draw that. And maybe he could do enough to treat 1 or 2 sites, but by going to 10 sites, you really, really shortchange the patient. So in summary, we have a low stem cell yield draw. We have no consideration whatsoever of the stem cell dose, and 10 sites being treated when 1 to 2 max should be treated. Was this a high quality or a low quality stem cell procedure that Terrell Owens got? Regrettably, given what I'm seeing here, this was a low quality procedure. So if you want high quality stem cell procedures, trust your care to a Regenerative provider. There are others out there doing good work as well, but that didn't happen here. Thanks so much and have a great day.